Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Larissa Trakin, and in today's episode, we're joined by Dr. Yazan Aljabery, a distinguished cardiac surgeon at Cleveland Clinic Abu Dhabi, a clinical assistant professor at Cleveland Clinic's Lerner College in the US, and also a bit of an Instagram hero influencer posting on public health, heart health, screening, all these very important things.
Sure.
Our conversation today is entitled Cardiac Crossroads, Meeting Today's Challenges with Tomorrow's Innovations. Doctor, welcome to the podcast.
Well, good morning. I'm pleased to be here today. Thanks for having me.
We have so much to talk about. Can you start with an overview of cardiovascular disease? Starting here in the UAE, to what extent is it an endemic issue? What are the unique challenges to heart health? What do you do about it?
Well, it is actually for someone who has practiced his medical life and specialized in the Western world. When I first came here, the first thing that shocked me was the age of the patients that we see. You can imagine that in the Western world, we're used to patients that are 60s, 70s, 80s, and we even operated on patients in their 90s. When I came here, the patients that we see are 35 years old.
With the same issues.
With the same issues that requiring even open heart surgery. Can you imagine that?
Why?
We're operating on patients that are 30s, 40s, and 50s.
Yeah.
And you've asked a very important question. Why? Why is that? I had to dig into it. So one of the major factors we can talk about is modifiable and non-modifiable factors. So there are factors that we cannot influence. The factors that get inherited to us, like the family history, genetics. This is something that we can't control. We can, at least for now. So we leave that for the end. At least for now, we can't control our genetics, our family history. But there are lots of modifiable risk factors. We're talking about hypertension, high blood pressure. We're talking about high blood glucose levels, diabetes. We're talking about obesity, lack of exercise, even screening. The population here is not into the screening programs. They don't feel the need or the push to go actually and get themselves screened. And unfortunately, by the time they find out about it, it's usually too late or at a stage where it actually needs an intervention. And that's a sad part that I think we need to focus on more. And that's one of the things that led me actually to go into the social media world and talk about it, raise awareness, ask people as early as 20 years old to actually go and get themselves checked. And if I may even share with you one of the very recent publications, it was published last year, 2023. And in that publication, they looked at more than 5,000 Emirati young adults aged between 18 and 40 years old. They did just a general screening of these people, and they wanted to see how common is the disease in this population. And believe me, the results were, I don't want to say shocking, they were eye-opening. You can imagine like a population with an average age of 27 years old had more than 60% rate of poor cholesterol levels, high LDL levels, dyslipidemia. The other one, diabetes, almost 12% of these young adults had diabetes, poor glucose control. Hypertension, around 20% were hypertensive. Obesity, more than 25% were obese. Lack of exercise reported by more than 50% of those people. So if we go back to the problem, we have so much to do still. There's so much of awareness to be done. There's so much for us to invest in this young population. They are the future. So we have to act. We have to act fast. And in this rapid evolving world, I think we have a big chance to do it.
This is something we're seeing around the world, especially in countries as they rapidly develop.
True.
And you're creating these habits, this sense of urgency, the things that maybe in Western countries, they had more time to ramp up. How is that? I mean, how's the receptivity? Are you able to convince people?
Definitely, that plays a big factor, to be honest with you. They say that more than 90% of the Emirati population is under the age of 40.
Wow.
So we are a very young population. And alhamdulillah, in a place like the UAE where everybody has health insurance, tertiary hospitals are everywhere. So access to hospitals is not a problem. We have to make most use of it. And when I started my social media career and started talking to the people, I was able to build trust with those young generation very fast. Alhamdulillah, it has gained so much traction in the past 2 years that I'm getting constantly messages and being asked by people directly to come and see me, do the screening programs, because you have to sell it as a very easy thing. It's non-invasive. You just have to go get your blood works done, get an ultrasound of your heart, an echo, just to see if you have any congenital abnormalities, do an ECG just to know your baseline electric activity of the heart. And if needed, after the age of 40, you can increase these things. And this has led to so much progress, at least since the past 2 years that I began. And this may take us also to the wearable technology. We have so much techniques and so much technology in our hands today that you can rarely find someone that doesn't have a smartwatch. And
Here in the UAE, or
here
there
in
a lot of
the
uptake?
generally worldwide,
Yeah.
people started like wearing these smartwatches. Now we have smart rings. Now we have continuous glucose monitors. These are very easy things to wear, and they can help us a lot. For example, the smartwatches. We had patients coming to our heart clinics with a condition called atrial fibrillation. They come to us, they're like, my smartwatch is alarming. They say, I have something wrong with my heartbeats. Can you please check? And you put them through these 24-hour monitoring, and you find out that they actually have irregular heart rhythm, arrhythmias. Otherwise, they would have came to us too late with what we can call stroke. Imagine this atrial fibrillation can build clots in your heart, and these clots can go all the way up to your brain and
This
cause
is
strokes.
huge. And so, as a community health issue,
Yeah,
I know we've heard it on the podcast again and again that here in the
True.
UAE, there is a true directive to move toward preventive care.
true.
And are you seeing this at the population level, that people hear that message and get on board and want to take these preventive steps? Is the momentum there the same way from the ground up as we're seeing from the top
This
down?
is the future. So if we look at the future of healthcare, we can divide it into three phases. There's the preventive, and there is the intra-hospital or inpatient phase, and there is then the follow-up and remote patient monitoring phase. In the preventive phase, the technology that's evolving is unbelievable.
And is the population taking it up?
There
moving in
is,
that direction.
well, I tell you, one of the best things that we have here is the genome, the Emirati Genome Project. This is one of the biggest things that we have here in the Emirates that we don't have in the whole world. We have more than 500,000 people that are already recruited. This shows that the people want to be on board.
Yeah.
They just need to be educated. They just need to be, we need to have more public awareness.
Yeah.
And then this young population is educated enough to ride on board and follow the
Knowing
steps.
that it's a preventive, precision health
Nobody
tool
wants that.
par excellence. Yeah.
Nobody wants operation. Nobody
Yeah.
wants surgeries. I'm a cardiac surgeon myself, and I know it. Nobody wants to get their open heart surgery. Nobody wants to get their chests open. Nobody wants stents in their hearts.
Yeah.
So if we can sell it in that way,
Yeah.
we can prevent the deterioration at a very early stage. You may not even need to take tablets even.
Yeah.
You know, some people are scared of chemicals. They're scared of tablets. There is counter educators on social media. Unfortunately, you have to understand that there are people that are pushing away from medication, pushing away from medical screening, and trying to push
Wow.
through nature ways instead of actually working together. Because we can actually work together and achieve best results with that. But some people are unfortunately trying to sell themselves as nature players, and they counteract what we do.
I am fascinated by what you're doing on Instagram
Thank you.
because this is reaching a younger demographic
Sure.
in multiple languages that you speak.
Sure.
What is the conversation? What are the questions they're asking you? What's the response to some of the things that you teach on that platform? And you teach active in clinic. You're very proficient.
Exactly.
But this
So-
is a public education.
When you go
tool.
for the public education, it's a totally different education. So when you talk to medical students, they have a medical background, you go very sophisticated. When you talk to the general population, it has to be more common words. It has to be in their language. It has to touch them or to provoke them. And that's what I sometimes use. Sometimes I take pictures of patients that I operate on during my surgeries. One of the recent videos that actually went viral was a video of a patient's lung, a smoker patient, and it looked horrible. And in the surgery, I just stopped everything. I told him, bring the cameras, take a picture of that. It was so dark, so black, and it had air bubbles in it. And these air bubbles, the problem with them, they can rupture at any time and cause a life-threatening situation. So people, when you tell them about smoking, they always think about cancer and cancer prevention. Unfortunately, it's not just about cancer. There's so many other diseases. There's hundreds of other diseases that can affect you due to smoking, and not just cancer. And after I posted that video, of course, after having the consent from the patient, going all through the legal work, this had millions of views. People went crazy about it. And I can tell you, maybe 20,000 people were ready to quit smoking because of that video. And they were sending me messages from all over.
What was the background of the man on the table?
He was a 35-year-old coming for an open heart surgery. He had
From the Middle East?
From the Middle East. He was unfortunate from the Middle East.
So that resonates even more for some people here who
he had a heart attack at such a young age, blocked arteries. They couldn't do anything with the cath and the stents. And unfortunately, he had to go for cardiac surgery as a life-saving option. And in that life-saving surgery, I saw his lung, and he reported to be smoking only for 15 years, but heavy smoker, life stress, whatever the excuse they come up with, it is not worth your life. It's not worth your future. It's not worth to go for a cardiac surgery at an age of 35 years old. So it
breaks through to people.
It hurts, you know? It hurts me as a surgeon to see those patients, and hopefully I'm able to pass the message to the young generation to please, it's not worth it.
I want to step even further into your life as a clinician.
Mm-hmm.
AI.
Yeah.
The new way one might do things versus the old way and the old challenges. What solutions, what real influence do you see in your life as a surgeon coming from AI and other emerging technologies?
Well, AI is such a disruptive technology. AI is going to transform the whole world as we see it, not just healthcare, but the whole world. And that made me jump immediately into AI in healthcare, get my degree in it.
You got a degree in AI in healthcare?
I got a degree in AI in healthcare.
I didn't know that existed.
You know, I actually, from MIT, Massachusetts.
Of course it does.
Yeah. And because I believe this is the future, this is what's going to get us. And we're not talking about 50 years, we're talking about 10 years from now. It's going at a very rapid pace. And this is where we have to be. Abu Dhabi is going to be a global hub for AI, technologies, genomics. And this is very transformative. I'll tell you, it's not just precision. It's not just early detection. It is a whole lot of pattern detection, pattern
Tell me
detections.
specifically, I mean, how does it change your life as a surgeon? How does AI change your life as a surgeon?
Well, we start with imaging. We depend in so many, like in our surgeries, a lot of our surgeries depend on imaging a lot. CTs, MRIs. And until now, we're dealing with radiologists, the CTs, the MRIs, the black and white. So I took it a step forward. I collaborated with New York University, and we have done for complex cases an AI program which is able to separate organs on your diagram, on the images, and then 3D print that. So you have an anomaly, you have a very rare and complex disease. Instead of facing it for the first time intraoperatively, on the operating table, time-consuming, surprise, no background about this. And I'm talking about my other colleagues, they're surgeons with 50 years of experience. We had a patient that had a rare disease that none of them has seen it before. And even in the literature, it's the only case that we have found.
Wow.
So what we did...
here in the UAE?
And he's here in the UAE, a patient from Dubai. We published that case. We took that a step forward. With NYU, we were able to print it in a 3D print.
Wow.
And simulate the surgery on that model instead of taking the measurements, knowing exactly our steps, knowing how to come out with the least amount of complications. And that's just one thing, that's imaging. That's taking the imaging a step forward. And we were able to do that, and it had a beautiful result. The patient is back home. He's with his family, enjoying his life, and he's coming for regular follow-ups. And he was a witness to the AI and what technology can bring us.
That's amazing.
Another thing that we want is post-operative patients. So what are some of the biggest challenges for us as healthcare specialists? Short staffing, especially of nurses. This is a worldwide problem. There's not.
And you're feeling the pinch already?
It is.
So it's talked about as a future problem and trends.
It's not a...
Yeah.
In the US, it's a huge problem. In Europe, in Germany, it is a very big problem, short staffing of nurses. And the other thing is bed utilization. So beds is also a very big issue
Yeah.
that we have to tackle. So how can we do that? There is now these smart wearables. There's so many devices that have been now years in the market. They have been tried and FDA approved in the US, and we're bringing them here to Abu Dhabi and using them on our patients.
Monitoring vitals, or what can they do that helps support the nurse
Well,
staff?
I'll tell you. Usual thing is that our nurses, they check up on our patients once every hour and take vitals around 4 times a day. Just making sure that our patients post-operative, they are stable and everything is going well. These devices are able to take more than 1,400 readings a day.
Wow.
They update you minute by minute of heart rate, breathing rate. Some have even blood pressure readings, telemetry, live ECG monitoring, and it can detect trends that cannot be seen by our eyes. So it's going to tell you that his breathing rate in the morning was 16, which is normal. Now it is 20, which is again normal, but it is trending up. So you better be aware, maybe he's developing a pneumonia. Maybe he's developing a lung infection. So look at that patient.
Sure.
They also detect skin temperature. So what is there a trend in temperature going up? Is there fever? That's still not detectable as fever by nurses, but there is a trend that he may be developing something.
Wow.
And you can detect him as early as 12 hours pre-deterioration.
This is incredible.
It is.
And
It
we
is.
hear about AI in such a generic, high level term, but these specific applications and how they will be force multipliers in your operating theater, this is what we really want to understand.
And I think that's just a small needle in the haystack. Because when I did my AI in healthcare degree, they were talking about devices like the Emerald, for example. This is a small router that you can just place in your home, and it can, from its place, detect your heart rate, detect your breathing rate, monitor your walking and patterns. If you get a fall, especially in elderly patients, it can report it immediately to the emergency department. And it's just a router. It's a small device, can even detect it through walls. Can you imagine that? Having a router in your home that's going to look after you when you're at home, or if you have somebody that's freshly operated on, or if you have an elderly person in your house, this device is going to be looking after him and alerting medical professionals at a very early stage.
What's your advice already, this many years in, to hospital systems and healthcare settings that want to integrate AI without losing that patient-centric approach?
Yeah. So patient-centric approach is gonna remain the cornerstone for healthcare. There is no way, and I can't believe even in the future, that doctors and patients will stop seeing each other, and patients will only be seeing a robot or an artificial intelligence platform, and he's gonna be doing all the detection, all the screening, and all the steps, all the way to the management, because there will be a lack of the human touch. That's why when people ask me, is the future for robotics and AI versus us? I tell them no. The future is for doctors equipped with AI skills versus doctors that are left behind and didn't embark on that journey. So I think this is a very good platform to call out for doctors, for healthcare professionals, even for nurses. Please look into that thing. AI is going to be our future, whether you like it or not. So you better embrace that. Accept it and see where it can fit in your career. Where can you learn stuff about it? And as soon as possible, it's gonna be there. It's gonna be on the ground, and you better be prepared.
You can't care for your patients as well without it.
No way.
Essentially.
There is no way. It has showed us that caring for patients can be 10 or 100 times better using and utilizing this AI technology rather than just the human approach, because we get fatigued. We cannot keep looking at the trends and detect everything. And even in underprivileged areas, let's take a place that has no access to radiologists, no access to pathologists, and there is just a single GP patient that sees in the emergency department 50 patients a day. Will that doctor be actually able to look at every chest X-ray of the patient, every ECG of the patient he sees, analyze it properly, or even compare it to old X-rays? He won't be able to do it. So if we have an AI software, an AI platform built in, at least it can highlight for him the things that he needs to look at and immediately detect those transformations at a very faster rate, at a very rapid rate, and save the patients a lot of misery and hopefully not miss something that could have been detected
And the
before.
things we've heard about early on, false positives or errors in the AI itself, what becomes of that?
Well, at every learning curve, you have a start where there are false positives and false negatives, and that's where we come into play. That's why it's
Clinician.
always important, clinicians and doctors and software engineers to come together. It's not a job for software engineers by themselves to develop these things, and it's not a clinician role. They have to come together, join forces, and refine this. And that's what is also called machine learning. So machine learning goes by uh, feeding it with massive amounts of data, and it will start detecting trends, start detecting patterns, and then we are there to refine that progress.
And say where it was wrong as well.
Exactly. And then we start teaching the AI software, this was wrongly detected because this is something that we usually see in those patients. Or this is something that we actually need to take more care about and compare it to X, X, and Y. And then we can come up with a more refined algorithm to detect those patterns.
This came up as we were hosting the Health Leaders Forum yesterday. We asked the
Nice.
audience in an online poll,
Uh-huh.
on the decision-making level, who's responsible
Yeah.
for the AI at those critical points? The options were the doctors, the software engineers, the hospital systems, and
Yeah.
the most common answer was all of them.
All of-
Everyone. No one's off the hook.
Everybody
Everyone's
together.
part of it, and everyone's
Everybody
responsible.
together. Exactly. Joining forces. And hopefully in the future, we're going to have clinicians with AI specialty and hopefully also software engineering capabilities. And this is where we're going. And that's just a very small part. We're talking about AI. Genomics, on the other hand, this is another life transforming event. Again, UAE is leading the world in this one. And we have a huge amount of data set. We just need now to utilize it properly, know where we can be on board and on top of things. Because with technologies like, I don't know if you heard about it, CRISPR is technology from the future. Like this is something that we used to see in science fiction. This is a technology that actually can alter your genes, change it,
How
and
about adult human or only in
until now it's
early?
more in animals.
Yeah.
But they have recently done it on a twin in Amsterdam in Holland. They have applied it on a twin with HIV, and they were able to remove the HIV gene.
A twin, like a
A twin.
digital twin.
No.
Twin people.
A human.
Human.
Human twins. So this was one of the biggest breakthroughs. A human twin in Holland who had HIV, they were able to take out this HIV gene from their system and prevent them from hopefully
Okay.
developing AIDS in the future.
Yeah.
So this is, again, cancer is one of the
Right.
biggest things. If we can early detect-
Predisposition or the actual tumor itself?
well, it starts with prevention. So one of the very easy things that you can do is go and get your genes checked. So in the past, when you used to check for genes, it used to cost around $10,000 to just check for a few genes. Now, for as low as $300, you can go and get your genome checked for more than 300 diseases. For $300, they can give you a path and tell you you have a high probability to develop, let's say, colon cancer. Based on your history, based on your genes, based on your clinic, you have a high probability to develop colon cancer, and you're 20 years old. So instead of waiting until you're 40 to get yourself screened, you'll go get yourself screened at the age of 30. And if there are small polyps, you have prevented yourself from getting colon cancer at a very early stage.
As a cardiologist, this
And
must
as a
mean a lot to you.
cardiologist, man, as a cardiologist, we suffer with patients that have something called cardiomyopathies. And that's a sickness of the heart muscle that leads eventually to heart failure. And we see patients at a very early and young age. For example, the case that we did a heart transplant for, 28-year-old Emirati patient
So sad.
who had severe heart failure, spent congenital, unfortunately. So that has to do with the genes.
Yeah.
His brother died at a very early age. He was diagnosed with cardiomyopathy, and alhamdulillah, we were able to intervene and save his life at the age of 28 after spending 3 miserable months in the ICU, struggling for his life. And with the help of the ICU team, the heart failure and transplant team, and the surgeons, we were able to get him a heart. And he had a heart transplant 6 months ago. And in his last visit, he was reporting that he's back to football. He loves football. And now he's back to normal life, back to his family. And that makes you proud of the institution, proud of the clinicians you work with, and proud of the UAE and Abu Dhabi, Cleveland Clinic, Abu Dhabi especially, that we have came all the way to actually be able to do this instead of sending patients all the way to the States.
I want to talk
as we
about
used to
that.
do in the past.
One of the last questions I want to get to
Go ahead.
in the time we have is about Cleveland Clinic Abu Dhabi.
Yes.
When it opened, it was a very big deal to
True.
bring that level of care and excellence here to the region and to the wider world. And now I already hear people from all parts of this half of the world, India, they're all flying to Cleveland Clinic Abu Dhabi. It's very special. What does it mean for Emirati communities, Arab communities, Middle Eastern populations to have a Cleveland Clinic in the name?
Well, I have to say, I am a very proud Cleveland Clinic Abu Dhabi clinician, okay, and a doctor. And every day I go with a smile and I leave with a smile because I know this place, not just in Abu Dhabi, not just in the UAE, but for the whole region, means hope. This is a place where you can get top-notch medical quality medical interventions that we use to look for in very specific and numbered hospitals around the world. So instead of people having to actually travel halfway around the world, maybe very sick patients that actually cannot even get there, they can get all the help they need at home, at Cleveland Clinic Abu Dhabi, at the highest standard possible. And believe me not, it's not because I am a clinician at Cleveland Clinic Abu Dhabi. What I see there, the disruptive technologies that we're using, the highest level doctors, the surgeons, the multidisciplinary team approach that I am seeing at Cleveland Clinic, I have never seen before in my life at other hospitals. The way we meet every day at 7 a.m. in the morning, discuss every and each patient's problem, I have never seen that done in such an open and friendly environment. Everybody's allowed to do their suggestions. Everybody is allowed to say their word about this patient and take part in the management of these patients.
So Abu Dhabi Global Healthcare Week, we're sitting here. It's the first edition.
Yes.
How's it been? What have you been taking away and experiencing?
Well, I think this is a declaration. This is a statement that Abu Dhabi is going to be one of the leaders in healthcare worldwide. We have seen Sheikh Khalid bin Mohammed bin Zayed yesterday in his opening word. We have seen His Excellency Mansour al-Mansouri. The vision is very big. The vision is not just a vision. It is actually, we're seeing it on the ground. We are getting all the support needed to apply it on the ground, apply it on the patients, and push it forward. And this is, I think, the place to be in the future. This is somewhere where everybody's going to be looking after.
Dr. Yazan Aljabery, thank you so much for joining us.
Thank you for having me. It was amazing to be here. It was a pleasure again. And I wish us a life full of health, success, and please don't wait until the disease manifests itself. Do the preventive step, get your screening done, and you are there for you.
Use these technologies for the prevention.
Use them.
I hope we continue this conversation. There's much more to talk about.
Thank you so much.
And thank you. It's a joy. Thanks for listening. You can like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.